There are a couple of key parts of what this agreement focuses on, but the head-to-health services are as big a game changer as what Headspace was when the coalition government under John Howard first introduced that program with Pat McGorry all those years ago. Our national plan includes just under $500 million to deliver a network of up to 70 adult mental health services across the country, just like we're standing in right here. And that builds on $114 million in the 2019-20 budget, where we first set up those first 8 centres across the country, 1 in each state and territory. And so now we're expanding them. And what happens here is on-the-spot support, care and advice without needing referral, without prior appointments, without charging out-of-pocket expenses. This is the sort of missing middle service that is desperately needed in mental health across Australia. We have services that deal with incredibly acute needs, and we see some wonderful work going on in the prevention space in the community. But there's a lot in the middle, and the lines are blurred between state and Commonwealth governments when it comes to who does what in that space. And that's why this partnership agreement is so important, because it brings state and Commonwealth together to try and fill that missing middle together. But there is more work to do there, and I can assure you as Prime Minister this would continue to be a very high priority for me. As Greg has known, all these years we've worked together. There's also the Headspace funding that has been part of our program. We've taken Headspace from just 56 centres when we first came to government to 164 nationally. This is an incredibly big initiative that is reaching out that early support and important support for people in their lives who are struggling with mental health challenges. And over the next 4 years, we're investing $873 million in the National Headspace Network to address demand and reduce wait times. So it's not just enough to have the centres there. Such as their success and support and usefulness is so many young people are looking to access them as well. And so we need to help them be even more effective in helping more and more Australians. And also here in Tasmania, we've been able to put in place the Early Youth Psychosis program. Now, this was available on the mainland, but it wasn't available here in Tasmania. It provides early intervention to young people aged 12 to 25 years of age who are at high risk or are actively experiencing their first episode of psychosis, and it's delivered from 14 Headspace centres in 6 jurisdictions across Australia, and that will now include, with the $206 million we put in this budget, to provide that care in both Tasmania and the ACT. And that builds on about $163 million we put in place before. There's also the work we're doing on eating disorders, some $215 million in services and support and research in that area. But today the partnership agreement specifically is a $55 million partnership between the Tasmania government and the federal government, with the federal government providing $45.6 million. And this is going into a number of areas. Firstly, $24.7 million to provide seamless mental health care for adults, just like we're seeing here with the establishment of 3 new head-to-health satellite clinics in Burnie, Devonport and Outer Hobart. And they will align with state-based services, including Tasmania's integration hubs. There's money for a new Headspace centre in Rosny Park and Hobart, and $2.9 million to boost the clinical capacity of existing Headspaces in Burnie, Devonport, Launceston and Hobart. There's $12.6 million for 3 kids centres, head-to-health kids centres. And what's great about these is they go within the Tasmanian child and family centres, child and family learning centres. So this is bringing parents and their kids, young kids, who can be experiencing real serious mental health issues, or not so serious but could develop into the future. And it supports them to get off on the right foot. There's also $2.5 million for the Tasmanian government to establish 3 eating disorder day programs here in Launceston, and as well in Burnie and is in Hobart. There's $5.2 million for universal aftercare services to support individuals discharged from hospital following a suicide attempt. The most vulnerable time for a person where they may die by suicide is after they have been discharged from hospital from having made an attempt. That is the clear learning of all the research and advice we've received. You want to bring down the number of people who are dying by suicide in this country, that's where we have to focus important services. so they can get that care in that immediate period after they're discharged. And this program provides support for that. And there's also $3 million to support perinatal mental health screening. So as you can see, this is a comprehensive package, and it's mirrored in all of the state and territory agreements all around the country. And it should say very clearly about what our commitment as a government is to improving the mental health of Australians, because I know that's what can improve their quality of their daily lives. Many things they can't control, but things that we can do to support them get through, whether it's just getting through each day or their recovery process over many months and years. They should know, I would hope, that our government is very committed to them and continuing to do the work. And the reason we can do all that, keep coming back to it, if we couldn't run a strong economy, we couldn't do this. In a country like Australia, with a government running its budget well and a strong economy, we can make a big difference in this area, and I really do believe we are.